and I will be presenting Comparing Patient Perceptions on Multiple Sclerosis Management and Care, a sub-analysis of geographic differences on behalf of the MS and the 21st century. This here is a copy of our full poster. Feel free to look at it in more detail. Today I'll be presenting the results of the 4 figures seen here. As an introduction, MS in the 21st century is an international group of persons with MS and healthcare providers who have come together to work on improving communication and ultimately supporting more effective shared decision-making and patient engagement and outcomes in persons with MS. The data presented here is from a 10-question survey developed by the steering group for persons with MS regarding their opinions around unmet needs in MS management. The aim is to compare persons with MS's responses of MS management and care across 2 geographical regions, Europe and North America. The survey was completed by persons with MS at multiple conferences, meetings, and was also available online. The questions permitted multiple answers and were non-compulsory, so the answers to each question may differ in terms of the number of responses. This allowed respondents to exclude questions which were not relevant to them. Although we received global responses for this survey, this poster will only be focusing on the differences and similarities between persons with MS in Europe and North America. You can see that it differs between Europe and North America. European persons with MS ranked time and emotional support as the biggest challenges. In contrast, North American persons with MS responded that understanding disease progression as well as treatment options were their biggest challenges. It's important to note, however, by looking at the responses to the far right, that very few patients from either region reported no challenges at all. This demonstrates the responses to the question, what additional support is available for patients in your clinic? While both regions stated that the 2 types of most readily available support were MS nurses and written information, European persons with MS generally reported greater levels of support across all the question options in comparison to North American persons with MS. Concerningly, again looking at the far right, around 1/4 of persons with MS in North America stated they had no additional support available at all. The majority of persons with MS in North America stated they were involved in the final treatment decision, with very few stating they had no involvement at all. This increased autonomy could explain their reported challenges around understanding their MS and lack of additional support. Conversely, only half of European MS patients stated they were involved in the final decision, and 1/5 were not involved at all. European persons with MS did report a higher desire to be involved in their treatment decisions. They also reported higher levels of support from their MS nurse. This increased support from nurses is likely to arise from the reported higher access to MS nurses in Europe. This slide shows the answers to the question, how does your neurologist talk about disease progression with you? More North American persons with MS stated that they were allowed to guide conversations in comparison to European persons with MS. Very few persons with MS from either region reported not wanting to discuss disease progression, yet in contrast, a substantial number of both regions' MS patients stated they had not yet discussed it. It is important for us to understand why there is this disconnect. It may be that healthcare professionals are avoiding discussing disease progression with their patients, or it may be driven by patients expressing a desire not to discuss the topic or not bringing up the topic as something to discuss, or it may be healthcare professionals' personal perception of what is best for their patients. Empowered patients are more engaged in their care but feel confused about lacking resources in North America. In contrast, European persons with MS are less autonomous and more likely to let their healthcare providers drive their discussions. This could be linked to their concerns around time and empowerment. However, it's important to note that both regions reported that difficult decisions are not taking place and that this challenge could be better understood. MS in the 21st century is constantly looking at real-world unmet needs to understand how to improve communication. Please feel free to visit our website to find out more, as well as to take our surveys to better help us understand these challenges.